Hey there, Chris from the Headache and Pain Management Centre with a video that was actually suggested by one of our loyal followers about retraction. So this exercise here and what it actually does to help headache and migraine conditions. So with this video, we'll be talking about how the neck works particularly and how we actually help with retraction to get the best results for you. So retraction, as I said, is this movement here. You're drawing your chin in towards yourself to give yourself a bit of a double chin. Now, when we talk about the neck and what it does with retraction, this bottom part of the neck actually lengthens, so you get a bit taller through this part of your neck, and then at the top of the neck, there's a bit of a nodding sensation that comes with it. How does this help headache and migraine? Well, if we zoom in, here is the top three joints of your neck. Now there's a couple of schools of thought about how this actually works to alleviate headache. So the first one is that there is a theory that in between number 2 and number 3 is the top disc of your neck. You can see it there, okay? Now one of the theories going around about headache and migraine at the moment is that it's actually a disturbance with that disc that is causing the issue at C2-3 and causing the headaches to happen. So when you do retraction type exercises, it actually moves number 2 back on number 3, causing that disc to be a little bit more happy, okay? Because most of the time people with headache and migraine have what's called a forward chin posture. So we're changing that position to get a little bit more pressure through the back of that disc to actually cause a bit of relief. So that nociceptive input, those signals coming from that disc, is being alleviated by getting into that position. The second theory behind why this may actually help with headaches and migraines is because of that upper flexion, okay? So bringing the chin in towards yourself. So you're moving this joint at the top. Now what we do know about headache and migraine when it's caused from the neck is that there's a lack of endurance of the muscles of what are called the deep neck flexors, the muscles that actually do that small movement. So when you're in retraction and you're holding for a long period of time, it's actually using those deep neck flexor muscles to hold. So you're getting a bit of endurance in that particular muscle group, which is causing that joint to be in a more neutral or in a more flexed position rather than being in a chin out extended position, which we do know can cause cervicogenic headaches to happen. So that's the second one. The first one is the disc, the second one is the joint. The third one is kind of my preferred explanation actually, is that when you have headache and migraine, obviously there is a lot of forward head posture, there's a lot of relationships with that particular position. When you're getting into retraction, it's actually teaching your brain that it can go in an opposite direction to where it normally lives. It's kind of like if you had a sore finger and you do this, well, if you had a normal finger, I should say. So if you had a normal finger and you bend it back like this, okay, it doesn't hurt, okay? It only, it's a bit of a stretch, but there's nothing that's too wrong with it. But if I was to hold this position for, I don't know, 5 to 10 years, then this joint is actually going to start getting really, really sore because it's in a position that is well back from where it could be or should be. With your neck, obviously the neutral position of your neck is kind of in a nice upright position, rather than being too far here, or of course too far back there, but not many people are there. If you're in this position for a long period of time, then you start bringing it back towards the middle. Yeah, it does hurt a little bit to get it back into that position, but it's the position that your body wants it to be in. I think what happens with headache and migraine is if you're in a forward head position, or at the very least that C2-3 joint that we're talking about is sitting a little bit forward like that, then what can happen is that your brain over time really doesn't like it and it starts to refer pain into your head as a result of that. So I think what retraction might do more than anything else is teach the brain that moving into a more lower cervical extension, upper cervical flexion movement is a lot more, well, it's a lot more balanced out than being in that lower cervical flexion, upper cervical extension position. So it actually just reverses the movement to where the brain actually wants to go. It's getting a bit more range of motion into those joints and into those muscles, which it otherwise wouldn't have had if you hadn't done that exercise. For whatever reason, retraction just seems to be a beautiful exercise for headache and migraine. We're still trying to work out exactly why it does that, but they're the 3 reasons why we think it might happen. The disc at C2-3, the joints and muscles that move OC1 in an upper flexed position, or perhaps all of it put together, just the movement itself telling your brain that the movement is indeed safe. That's a really good question. Thank you for that to that viewer who did suggest that. And if there are any more questions or any more comments, any more things that you want me to do a video on, please just type in the comments, because I use what you tell me to actually do the videos that I do produce, because I want to help you get the best results that you possibly can. I hope that's been really helpful, and we'll see you again next time. Cheers and bye for now.